When our speaker, Mick McDaniels, reached out to me, I was really happy to hear about another Rotarian international project. And so it's my pleasure today to be introducing Mick McDaniel. Mick, at the age of 23, and his college girlfriend, Donna, at 19, got a couple of witnesses and ran off to get married in 1968. Although they don't recommend it, it must have worked okay, because they are still married 54 years later. They have 2 grown boys, 7 grandkids, and 2 great-grandkids. In 1993, the McDaniels moved to the Czech Republic and joined an international nonprofit organization by the name of Operation Mobilization, where they served for 7 years. They were requested to come back to Washington State to serve as the Northwest Regional Directors for that same organization, and did so until 2009. Mick and Donna founded a nonprofit 501c3 organization, which they named Global Helps Network. In 2009, Mick traveled to India and began making connections. He's made 9 trips to India so far. In 2010, Mick met the president of Tacoma South Rotary on the racquetball court, who invited Mick to join Rotary. Mick very quickly became the president of that club in 2013. He also became the grant writer for the Tacoma South Club and has completed more than a dozen projects here locally and internationally. District 5020, a Rotary district across international borders, has completed many projects in India, including clean water projects, computer training vocational training schools, tutoring children to get them back to school, and now the newest project, community health workers in India, which he is going to share with us. Thank you so much. It's all yours.
See if I can. And don't know if I'm set up to share. But are you seeing my screen?
You want to? You got to hit share your screen.
Oh. Now we're good.
Looks
See
good.
if I cycle through, okay. There we go. All right. So greetings from Tacoma South Rotary. So we meet on highway the I-5 and 72nd Red Lobster. And I don't know if you've heard of the putt-putt golf tournament that we do at the Harkness Furniture. Have you heard about that? Okay, we've been running that for about 22 years now. And it's kind of crazy because the Harkness family, longtime Rotarians, they set this golf course up inside of a furniture store, and it's like 3 stories high, and it's about an acre of property. And so some of these are up on a 2nd story level, but there's handicap ramps, so they just kind of cut down the ramp, and it goes around, it goes downstairs for the hole. We have a jazz band that comes in, and we're very involved in local projects. So it's been fun. I think the last year we raised like $60,000 through that golf course. And we're very involved in a lot of local projects. Usually our fundraisers go to that. However, our Rotary Club is always the first one to put in some seed money on these Rotary projects that are international in scope as well. So anyway, so greetings from the other side of the bridge. But so people often ask me why be involved in India. And the reason is that now we have a 14-year history, and we've just had a lot of success with the projects that we've completed. And we're finding that our projects are so successful that a lot of the clubs use our PowerPoints, our pictures, our stories of transformation to actually advertise and increase the membership. And I give you complete bragging rights. After today, I'll be challenging you to join us financially in a partnership. And I know that's not going to happen today, but I'll send you a proposal at the end. And if you decide to do that, I'll give you complete rights. This can be 100% your project. So you can tell everybody that we're involved in India, and there's some great things that we're doing. So I'm going to just move through the PowerPoint. Feel free to interrupt me at any time, and we'll answer questions as we go along the way. I'll also give you a little time for Q&A at the end. So your first question that you're probably asking is that you'll probably want to know, what do community health workers do anyway? I am so glad you asked. I'm just going to put a whole bunch of things up here, and then I'll be touching on most of these as we go through the slide deck. But they provide non-emergency care. They train in hygiene and disease prevention. They create and maintain health records. That's a really important thing. I'll spend a little time on that when we get deeper into it. They assist in midwifery, that means childbirth, and they obtain birth certificates. That's another huge thing that I'll be sharing with you about. They administer meds and vaccinations. They visit clients in their home villages. That's something we don't even get in America. When was the last time a medical professional visited you in your home? You know, it just doesn't happen. And so they refer clients to the doctors, and they are liaisons between the big city and the villages. So here's what health care workers are not. So they're not doctors, and they're not even professional nurses. And they're not a substitute for hospitals. But what they are is what we've got to work with. This is the first time something like this has ever happened. We've trained these health workers. They're basically high school graduates or some college age young ladies, and they take a short training. They learn a lot of I'll just share with the PowerPoint. You'll see some of the things that they learn, but they take some vital statistics, they maintain some records and that sort of thing. And then they travel around a circuit of villages, usually 5 villages in a cluster, and they call on these people and they provide this wonderful service. So I'll dive in a little deeper. A lot of times in America, we think that natural childbirth is something that we invented, but it's been going on forever. And honestly, that's the only kind of childbirth that takes place out in the village, because it's very natural. And many of these women have never been to a hospital. And so this is standard. But our younger women that are the community health workers, they're learning from the experienced older ladies that are able to teach them about natural childbirth. Midwifery is fun. Now, here's something that's surprising. What's surprising to me is that a lot of these children, because they're born out in the villages, they have no birth certificate. There is no legal document to show that they even exist. So this is one thing that has been a brand new added value, is that these young women are there, they witness the birth, and then they fill out the necessary paperwork, and they take it into the government agency, and they give all of everything that's necessary in order to make that a valid birth. So they also provide medical history as the children are growing up, and they were starting with the mothers and the children, and then we're working towards the fathers and working towards extended family. But we're creating these medical documents so that if there is an emergency that takes place, then they've got something to start from. But not starting from scratch, they have no history about it. And the village workers are calling on people in their little huts or their homes. And we start each project with months of preparation. And we actually go and teach on health and hygiene and sanitation before we ever introduce these health workers there. And so we're setting it up so that they'll be very well received. And by the way, we're actually sending these young ladies back into their own community. So we bring them out and we train them, and then we put them back in. So there isn't like an outsider problem. They're not adjusting. They're very proud of that. This is their own. This is their own young ladies, and they got a profession. They went away and they came back in a white smock, and they got stethoscopes and everything. I mean, it's very, very exciting. I've done a lot of projects in India. I have never seen anything that has been received with so much excitement as this. They get the attention of a medical person. So we spend time, we survey the village leaders. We want to make sure that they have buy-in. For those of you who have done international projects, very, very important that the host country feels that it's their project. And if they want to be the driving force, then we're going to have a success of something that's positive out of the way. If we have to sell them on the idea, first time something goes wrong, we're going to get that project back. And that isn't a good thing for anybody. So we do hire registered nurses to do the training. We purchased the recommended equipment, and we actually had to develop and print the curriculum because there wasn't anything like this before. So very exciting project. I hope you can tell I'm excited. All right. So in November, we did the training in northern India. And you see there's a little sign up there on the screen, and it tells the dates and where it took place. It's in northern India, a city called Lucknow and Uttar Pradesh. And so this training took place back in November. I was given the privilege of teaching a course. They actually prepared the curriculum in Hindi and sent it to me, translated in English. Then I presented that material to them, and then it went over Zoom. So I've been in from the very beginning on the whole presentation, and it was very cool. I don't know if any of you worked with a translator, but I have a tendency to speak way too long. They say, they have to kind of catch up with me, and I can ramble on sometimes, but it's a lot of fun. So this is a picture that was taken. These young ladies, except for the lady in the white smock in the front, she's the registered nurse. The rest are students, and they are taking blood pressure, and they're kind of watching in amazement how this all works. So this, if the video works, it's just a few seconds long, but I'll see if that starts the video. At the very end. Yeah, so you just kind of watch. They're amazing. They're listening to the heartbeat. They're using this equipment for the first time, and just a few weeks later, they're going to be out in the village actually performing these procedures. So this is the graduating class, and there were about 20 students that graduated, and they each have a certificate. Now, in case I forget later on, I want to tell you that getting a certificate of completing any kind of a course out in a rural village in India is very, very important. And so a lot of these children, young ladies, are taking this into the public schools. There's no teaching, no training on just basic health and hygiene, nothing in the classes. So every one of these students with their certificate can go out boldly and they can teach health and hygiene in their classes. And some of them are using their certificates to get entry-level jobs in nearby cities with the doctors and government officials. So we provided the training, and out of this group, we chose 4 interns that will actually get a paid job. They get a stipend, and that's covered within the project for 1 year. They know that it will not go beyond that, but the funding is for that time. Now, at the end of 1 year, we're pretty sure that the local NGOs, non-government organizations, or nonprofits will take over these projects, so they won't be a burden to Rotary. But 4 of them actually are now working in India. They get a stipend. So now here are the pictures of one of the community health workers a few weeks later out in the village, and she's doing the blood pressure test, the blood sugar test, and then that picture in the bottom is just with the height. They're measuring the height. The goal is that every family will be seen by these community health workers, and so they set up a route and they travel through 5 different villages, and there's 4 of them, so we're covering 20 villages with this group of graduates. And then we hired another registered nurse, and they go out and meet them periodically on the route and answer any questions and do further training. And then we have a person who's overseeing the whole project, kind of as a project administrator, and he makes spot checks and travels out. Actually, every week he's going out and checking on the project. And an interesting thing, and this isn't in my notes, so I won't, if I don't say it now, I'll forget it, but have you heard about the app WhatsApp? And I know some of you guys are not, real techie, but WhatsApp is sort of like the equivalent of Facebook, but in developing countries. And so WhatsApp, everybody has a cell phone in India, no matter how poor they are, they all have a cell phone. And what they have been doing is these community health workers are out in different areas working, but they use WhatsApp, and they're sharing pictures, they're sharing updates, and there's just a whole movement that has come out of our Rotary project. And there's so much demand. We've got people backed up saying, next time you do a school, please get our people into it. It's been very, very popular. And that WhatsApp thing costs nothing. I mean, they're doing this, the students are they're posting their own pictures, they're telling stories of transformation. Wow, it's just a great thing. We didn't see that one coming. So anyway, now we got a curveball thrown to us. This caught us by total surprise. It's not really popular to ask women their weight, right? I mean, I get in trouble with that. I do that. But if we saw a young lady and she weighed like 100 pounds or something, we'd be a little concerned about it, right? Okay, so you think you've got anorexia or bulimia or something going on. Well, this is a mother of 3, and she has 3 kids, and she weighs 66 pounds. And that shocked us. We wondered what was going on. So after they interviewed her and found out she has very little food, only rice. No, nothing to add to it, only rice. And she was saving the rice for the kids. So she was drinking the water or the broth off of the rice. That was what she lived on for about 4 months before we got there. And we found out she wasn't the only one in this situation. We found about 10 women that were all about the same weight. This is more extreme, but we want to know, what do we do? And we have this project, we got this Wake Forward, we're just out there checking people for, all these vital statistics, we're building these records, we're communicating with the local officials. We got this program, but all of a sudden, man, we're showing this curveball. So what we did was, we put together a test case. We took the 10 women and we purchased some supplement for them, a 6-month supply of supplements. And now we have a meeting with them every 2 weeks, and we're trying to see if we're only dealing with nutrition. We think we are, and we're kind of weighing and measuring and gathering the statistics. Now, this is not a long-term solution. I mean, there's a billion people there in India, but we can't be putting them all on supplements. So we are just monitoring this, and then this has started a lot of discussion as to what we could do positively in the future. How do you really impact villages? Don't just go in with a project. What can you really do? So there's a lot of good stuff that's coming out of it. We're talking about kitchen gardens. How can we prepare, help them learn how to plant their own gardens and take care of themselves. I don't expect any of you have been to India, but I've been there several times. And what surprises me is they have animals that don't even have access to the fields. They have to go out and cut the field, cut the grass or the hay, and they bring it into their water buffalo. They don't have any gardens in the village, but there's fields out there that are owned by rich people, and they're harvesting those. And there's just nothing out in the village. They're bare. I mean, it's dirt and nothing growing there. So we're looking into composting toilets. We're looking into kitchen gardens. We're looking into kind of revitalizing the whole community. But this was just a side jaunt, from the project. So we're taking note of that. We have a little project that we're learning from, but it's opened up a whole new realm for the future. Okay, first aid kits. I just want to say quickly that we started this project by learning about 2 young women who had been badly burned in a kitchen fire. And it took several hours. I think it might even taken a whole day just to get some gauze and some ointments there, because there's nothing like that. They're an hour away from the biggest city. And so we started out with that information. And so we decided that we would build first aid kits into this project. So the community health workers, as they're traveling their routes, we supplied them with extra first aid kits, and then they're teaching first aid as they go along. And then as they come back, they're replenishing their first aid kits. So you can see this is having a long-term effect just in that process itself. Okay, and then I'm going to give you a kind of a quick summary of the project. But this is like one of those commercials on television, and I'm going to say, but wait, there's more. So anyhow, anyway, what we've kind of covered so far is the village families cannot travel to the big cities. So this gives them medical help out there in the villages themselves. Medical records are being performed for the first time ever, and that's a brand new thing. They now have some medical history. The community health workers are acting as liaisons to the city, and this registered nurse is a big part of that because she's coming from the city and helping us get connected with the medical facilities. And the rural children now have birth certificates, and that's a mic drop right there. So we are being told that that's also helping to reduce human trafficking, because we are taking pictures of the kids, we're keeping records, and now it's not so easy to take children away and lose track of them. And we're impacting 20 villages, and this project will impact potentially 4,000. Okay, so it is kind of a ripple effect. We're also teaching a marketable skill, not only to the 4 that were selected in interns, but all of these have got an opportunity to go with their certificate and maybe get an entry-level job. It just wasn't there in a matter of weeks or months before for these young people. This does include stipend for the community health workers, so that's paid for 1 year. And then after that, the NGOs or non-government organizations will take it over. I think I mentioned that earlier. Now, you have one big glaring question. I'm sure that this is on the heart and the mind of every one of you right now, and that is, how can I help? Right? I'm so glad you asked that. I anticipated that, so I put it in here, you know. Anyway, so here's where we are on our project today. And I think this is a very low budget for all that we're doing. $21,700 of all of this. And here are the participants up to date. I received $16,400. I only have $5,000 to go. And frankly, the $5,000 is to cover that stipend because we're paying that monthly. So they're all of them are working out there right now. So we're paid current, but we don't have it for the whole year. So this is going to help us wrap up the project, and $5,300 and we're there. So I will leave. I've already got contact information. I'll be following up with all of you. And I just want your permission as a club to send you a proposal for partnership. And I'll send that to you. Then you can take it to your board meeting and decide whether I'm a good guy or a bad guy. And you can say, you know, don't you ever come back here again? Or sure, here's a check. I've only had one time the club says we're in and handed me a check, and that was about 6 months or so ago, and it surprised me. So I'm used to the process. So what questions do you have for me? Yes.
Is there an in-country club partnership with another Rotary club in India, and this is a global grant, or has that been explored?
Wow, we got about 3 questions at once there. So there is no in-country partner because this is a district grant and it's not required. There is a special requirement in India. Am I off camera or am I a bad place? Should I get back there?
I can't, you're still sharing your screen.
Okay. Okay, all right. Do I need to put my camera on, or is that good?
But you're good, you're good.
Okay. All right. Okay. All right. So there was a question about, is there an in-country Rotary club? And have I explored the opportunity of taking it to a global level? Is that, yeah, okay. So there is not an in-country club. We've looked into it a little bit, but we haven't established that yet. Because this is a district grant, there is not a requirement for that. India is the only country that I know of that has a special requirement. They require, the Indian government requires for any organization to participate with a nonprofit, which we call NGO, non-government organization. They have to work through a FCRA, Foreign Contribution Regulation Act approved organization. So that's like their approved nonprofit organization approved by the government. And that's a bigger hurdle to jump through. And in the past, I think that the Rotary clubs were kind of given a bye, but they're not anymore. So even if I had a club that would participate, I'd have to also get the FCRA approval. I do have the FCRA approval, and we have an organization, so that was enough. We said, okay, we're doing that. So we have that approval. So a long answer. We are looking into global grants. As a matter of fact, we have a grant in process right now that could be raised up to a global grant. What I did is I submitted it as a district grant. I'm looking into if we can meet the criteria for a global grant, then the district will just pass over what we've got, pass it on to the global grant people, and we'll get it all done. So I hope that covers it. Yeah, thanks, Larry. Yeah, yes, sir.
What is the general size of these villages that you are visiting? And how often does one of the care workers visit that particular village?
Yeah, excellent question. I think they're fairly small. They're like 200 people in a village, and they are out traveling on a route all the time. I would say that they probably spend 1 week in a village, and then they move on another village, and they probably cover 4 or 5 villages in a month or a little bit more, something like that. So, and then they all work together. Now, I mentioned before that we have done many projects in India, or it was in my intro. We've done computer schools, we have done clean water projects and that sort of thing. So these are areas that Rotary has some history in, and those require a building that we're renting in order to run those buildings. Those have been taken over by the nonprofits, but they were established by some Rotary projects in the past. But there's a facility, a building there that we have. So what we have done is we have had the community health workers stop in those buildings, like that one where we discovered the lady that only weighed 66 pounds. That was actually at a tailoring school where they are learning how to sew. And so they just hit all of the young ladies that were working in the tailoring school. And so that's kind of how we worked the route. We went back to the places that we've already got some a foothold also. Very good. Any other questions? Yes.
So, and I apologize if I missed this in your presentation, how many women have been trained yet to date?
There were 20.
So this is the first round,
Yeah, that
you're
was
in
the
the
first round.
beginning
Yeah.
stages.
This is the first time ever.
Okay.
Yeah.
Great, and then, next I was gonna ask, like, how had COVID changed, but if this is the first round.
Yeah, we're actually kind of after the COVID.
Wow.
Yes.
The way you describe the situation in general, it sounds like there's a big gap in services between if you live in the city and you're in the village.
Absolutely.
And I'm wondering, is that due to societal stuff like becoming inequality or the caste system, or how I don't understand what that's kind of a big question.
Five words. That's above my pay grade. I mean, really, there's so much need, and that's such a blessing, but we can't fix everything. And some of the biggest stuff that we can do is find good partners on the ground. We do not say who needs help. I mean, we do ask who needs help, but we don't go in with the idea, I want to help this area, I have this pretty good idea. But we have some really good trusted people, and we say, where do we go? And so they direct us, and they're wrestling a lot with all of those issues you mentioned, that not our thing to go in and fix the government or fix the whole thing.
Yeah, it sounds like you said, you're not there to fix it. But it sounds like you steps in that direction just by showing up on the ground.
Yeah, we really are, and there is a ripple effect. Any more? Oh, lots of questions.
Do you have any information on the current health of the mothers who are starving themselves for the babies?
I was thinking back, I wonder if I've heard anything. I have a Zoom call fairly frequently to India, And nothing was mentioned, but it's time for me to, give a little update and see if we've got some statistics. But thanks for the reminder. I guess we're.
These are assisting with the vaccination efforts, the polio campaigns, that sort of thing.
Well, the polio campaign is, as I understand it, I've never been a participant in that, but I think that they are really very well structured. So they'll go in, and I think that they work from, government officials and get permission, and they get point people lined up, and they ship the equipment in and everything like that. We are really from the bottom up. So we go into the local nonprofits and we say, how do we help, and who are the people we're helping, where are we going today? And we go with them and that sort of thing. So this is totally from the opposite end. We're really down to the big need is, but is that it?
I just want to say, I think it's incredible, is that twofold approach, right? Like, educating young women and then opening so many career pathways for them, like the sky is the limit, right? And then you're also supporting those who wouldn't receive the care and connecting, making those technological, connections with the app, the apps and everything like that. So I just want to say, great job.
Thank you, Stan.
You know what else? Instead of going in there like other NGOs in other places have, like we're going to say, go in there and empower people on the ground. That's awesome.
I was so pleased and actually kind of surprised that the women who are not given employment, who can't do the budget, that they happily took their document and the training curriculum that we provided, took it into the school, and the school said we had nothing like it, and they were empowered just to be able to stand before the class and teach them things that they learned in school, and the school was happy to have them, and so we're having a positive impact, and that empowers even the people that didn't get it. So rather than doing and touting or saying, well, I wouldn't like it, but they feel great, honored to be able to have that up. Okay. All right, am I fired? Thank you so much. I really